Take a few minutes to discuss the risks associated with proton pump inhibitors, or PPIs, also commonly known as acid blockers. Over the last decade, there's been a lot of negative press about these medications, and I want to list a few of them so we can discuss a little bit more in detail. They include chronic kidney disease, dementia, bone fracture risk, C. diff, a gut infection, as well as a theoretical risk for increased risk of gastric cancers and colon cancers. Now, in the scientific community, when we look at literature, we like to assess the quality of the evidence. And a lot of these publications have low to very low quality of evidence. I think that's important to keep in mind when we're looking at all of this data. And not to mention, I think the other flip side of this is when I have patients who have real reflux disease, GERD, symptoms of GERD, that are keeping them up at night, or you're having pain throughout the day, not able to function. I think that's also an important part of this conversation. The benefits of PPIs also need to be discussed because you can have reduced risk of stricturing in the esophagus, or narrowing that requires dilation or treatment, reduces the risk of having cell changes such as Barrett's esophagus, which increases the risk for esophageal cancer over many years, and also reduces the risk of ulcer formation in the stomach, especially for patients who are on blood thinners for heart disease, or NSAIDs like Aleve, Motrin, ibuprofen for chronic joint pain. And so, there was actually an excellent study back in 2019. It came out of Canada, where they actually looked at patients who have coronary, artery disease as well as peripheral vascular disease. And so there were about 17,000 patients, and it was over the course of 3 years, they actually split up the group into two populations. One group got an acid blocker every day, another group got a placebo. And they wanted to look at those risks I had outlined, before. And what they found was, over the course of 3 years, there was no change or no risk of any of those things, including kidney disease or dementia or gut infections, especially C. diff. There was a little risk of enteric infections, which are just run-of-the-mill salmonella, E. coli, those sort of things, but nothing else that was seen in the study. And so a lot of those risks were debunked. So let's get to our patients here at Gastro Office. Our goal is not to keep you on long-term high-dose medications. I think it's really important for us to have our patients on the lowest dose possible, but I also think it's really important to weigh the risks and the benefits. For those who are worried about long-term risks, I think that's a great approach. And the last thing I will say is that for patients who are really risk averse, we do offer studies called pH monitoring, where we can actually place a probe in your esophagus, and over the course of 24 to 48 hours, we can actually measure how much acid exposure you're having. And so there are a number of ways we can address this topic, and at least this is just something to start the conversation.